In Nigeria, a group of nurses from the United States will be providing free medical care to the people of Lagos State beginning on Sunday. Organized by the Yoruba Nurses of North America, the yearly medical missions are aimed to promote healthcare, welfare, and to give back to the communities. Officials of the nurses group say key issues the mission will focus on include the limited access to primary health care, lack of health literacy, mental health challenges, as well as nursing training. For more on the medical mission, I reached Dr. Modupeola Adebayo. She is the chairperson for the Board of Trustees of the Yoruba Nurses of North America.
Our goal is really to give back to our community back home. So in doing that, we actually target the main problem there, which is limited access to primary health care. And so primary health care really consists of taking care of people before they get sick. So we are not going to wait for people before they actually get sick. Similar to what we are familiar with here, where people will go to the clinic, they will go for their immunization, they will go for well child care, the adults will go for their annual physical just to make sure that everything is going on well, and then if there's anything that can potentially happen to them, is already picked up before it actually gets to a situation where complications will happen.
There's also what some people say, the lack of health literacy in the communities. How do you plan on tackling this while you're on the ground?
So one of the things that we're going to do, aside from checking their blood pressure and their blood sugar, we're also going to do what we call counseling and education. So we will have our education table. So our education table is going to consist of, education about diet, about lifestyle choices, about even predispositions to some of those conditions, based on whether they have a family history of it or maybe even in their environment. So those are the things that we will educate people about their diet and the impact of diet. We will also educate them about some of the choices, like, do they engage in exercise? Do they also, engage in certain behaviors that can compromise their health, such as, drinking and smoking, and even something as simple as hand washing. Because people don't even know that, when you cultivate the habit of washing your hands all the time, you kind of reduce the number of your exposure to communicable, diseases or infections. Those are just one or two areas that we're going to address, but there are also other areas.
Talk to me about mental health challenges, because as you know, in a lot of African countries, they usually don't focus on mental health. Talk to me about that.
Mental health. So because of the stressors, there are lots of stressors in our environment right now. And it's global, it's all over. People may find themselves unemployed. People may find themselves in different life challenges, family issues, but especially in Nigeria, where, the cost of living is extremely high. People don't even have enough to feed their families. All these are sources of stressors. And because they are sources of stressors, people maladapt. And when we talk about maladaptation, people will turn to the wrong way to kind of relieve or to find succor to their problems. So with that, we want to kind of address some of those, because people don't understand that with pain that are emotional pain, which is not physical pain, it takes its toll on the body. If you do not address emotional pain, then it manifests into physical pain, and then it can cause all of these other conditions in life, like stroke, high blood pressure, and even heart failure, and those other conditions.
Talk to me about nursing training while you are there, and is your organization partnering any international organization to give more access to healthcare?
So nursing training is really very, very important, because as we know, diseases are not geographically bound, right? You cannot, like, for example, when, a disease does not know that, this is Nigeria, this is US. So because of that, training has to also imbibe that as well. We have to thread that into training. So you don't just train people just for a specific, to take care of people in a specific area, but you want to train them in such a way that, wherever they are, they can actually be able to take care of people. And so that's where we're talking about international collaboration. So international collaboration is where, for example, here, having like study abroad, partnering with schools, in Nigeria to kind of do, things like exchange. We can even do virtual exchange where we will have students here do assessment, and the students in Nigeria will watch them do that, and then the ones here will watch the ones in Nigeria do like a teach back kind of deal. So that way we're collaborating and we're training, we're training everybody.
Dr. Modupeola Adebayo is the chairperson for the Board of Trustees of the Yoruba Nurses of North America. She spoke with me from the Nigerian commercial capital, Lagos.